Acute lymphoblastic leukemia, ALL, is one of the most frequent pediatric cancers and the second most common adult acute leukemia. Symptoms include fever, bone pain, and increased risk of infection. Originating in the bone marrow, lymphoid progenitor cells normally mature into functional lymphocytes, crucial for maintaining immune function and health. ALL occurs when progenitor cell differentiation is disrupted, forming immature leukemic blast cells, which proliferate uncontrollably, accumulating in the bone marrow and peripheral blood. Asparagine is a non-essential amino acid required for cell proliferation and survival. Whilst healthy cells synthesize their own asparagine via asparagine synthetase activity, some leukemic blast cells expressing little to no asparagine synthetase become dependent on extracellular sources to fuel their growth and survival. Asparaginases are enzymes that catalyze the breakdown of asparagine into aspartic acid and ammonia. Treatment with asparaginase depletes circulating asparagine in patients, thereby selectively starving and killing the leukemic blast cells. Two of the E. coli-derived asparaginase preparations include unmodified L-asparaginase and the pegylated L-asparaginase oncaspar, pegasparagase. These have greatly contributed to improvements in ALL treatment outcomes, becoming widely used in pediatric protocols with well-established safety profiles. Oncaspar is a modified form of L-asparaginase with conjugated polyethylene glycol, or PEG, moieties. Oncaspar is indicated for ALL treatment in pediatric and adult patients as part of a multi-agent chemotherapy regimen and has a safety and efficacy profile that is similar to native E. coli asparaginase. As with native L-asparaginase, oncaspar reduces asparagine levels and starves leukemic blast cells with low expression of asparagine synthetase of their asparagine source. Consequently, those leukemic blast cells cannot survive, whilst healthy cells remain largely unaffected. Oncaspar's pegylation increases its molecular weight and size to prevent reticuloendothelial system uptake, reducing renal clearance and extending the enzyme's half-life. This prolongs oncaspar's activity compared with native L-asparaginase, which leads to sustained asparagine depletion in the bloodstream. Pegylation may also help to shield the enzyme from the immune system. By masking immunogenic sites, pegylation may limit recognition of the enzyme as foreign, potentially reducing the risk of hypersensitivity reactions and the production of treatment-neutralizing antibodies. The prolonged circulation in the bloodstream and decreased immunogenicity help sustain asparagine depletion, permitting oncaspar's less frequent 14-day dosing schedule as part of a multi-agent therapeutic regimen, compared with every 2 days for native asparaginases. This translates to more convenience and less treatment-related anxiety for both patients and caregivers. Oncaspar is also available in a new lyophilized formulation, providing the same benefits as the liquid formulation with a longer shelf life. Oncaspar is widely used in pediatric protocols, with growing use in pediatric-inspired protocols for adolescent and young adult treatment groups. Treatment protocols that include asparaginases, such as oncaspar, have a well-defined safety profile and demonstrate improved survival compared with those that do not include asparaginase, offering an effective therapeutic combination with chemotherapy for patients suffering from ALL.